Hello, my name is Min An. I'm a board-certified facial plastic surgeon, and I'm going to talk a little bit about advanced filler techniques using Juvederm, and in particular for treating the tear trough deformity in the corner of the mouth. My office is located in Westborough, Massachusetts, and we offer a full range of facial aesthetic treatments including skin care, Fraxel laser treatments, Botox, Juvederm, and facial plastic surgery procedures. As you may know, Juvederm is made of a material called hyaluronic acid, which is a naturally occurring substance in all of our bodies. It is FDA approved for treating moderate to severe facial wrinkles and folds, and the nice thing about Juvederm is that it is a long-lasting filler, often lasting more than a year, and it promotes the formation of collagen in your body. When Juvederm is used for treating the corners of the mouth and the tear trough, it is considered an off-label use of the material. When we talk about the tear trough deformity, we're talking about that area on the corner of the lower eyelid that loses volume as we get older, causing a hollowed appearance that makes us look tired. So my approach to improving the nasojugal groove using Juvederm is to place small amounts of the material just above the level of the bone of the eye socket to fill that trough and add volume. And it's very important to use small amounts so as not to overcorrect and cause a puffy appearance. Here's a video of Amy undergoing a treatment of her tear trough using Juvederm, and as you'll notice, with just using a little bit of ice for anesthesia, she's very comfortable. And I'm placing small amounts in what is known as a serial point technique, meaning small amounts placed along the rim of the lower eye socket, separated from each other, just to add a little bit of volume there. You'll also notice that there really is no bleeding, that she's very comfortable, there's no bruising, and there's an immediate effect on filling the hollowing in that area. I do mold it just a little bit to make sure that it's nice and smooth. The treatment takes a short amount of time, and typically there really is no recovery at all. I do think that there are certain advantages using the serial point technique. Number one, it looks most natural in terms of the result. I also think that it causes less bruising than the threading technique, and it's going to look much less puffy than if you place a large amount of the material in one spot and then try to mold that. The nice thing about performing this technique to rejuvenate the lower eyelids is that you can do it in the office, again with just a little bit of ice, and you can get the kind of improvement that traditionally we would need to perform a lower eyelid lift to achieve. Another advanced technique using Juvederm that I commonly perform is to fill the corner of the mouth that develops a groove as we get older. By filling the corner of the mouth, we eliminate that sad appearance and make the mouth look a little bit more youthful. And again, it's very important to use small amounts so that we don't overfill. And in this situation, I do use a linear threading technique. And as you can see here with Janet, there's just a little bit of redness and swelling. You can have a little bit of bruising afterwards. I do think that the linear threading technique gives you a very natural appearing result that actually does lift the corner of the mouth, and that this looks better than just placing a larger amount of the material in one spot and then trying to mold that. And as you can see here, there really is minimal discomfort and really no bruising at all. To learn more about this technique and to see before and after pictures, please visit us at our website at www.awcenter.com. So that's a brief description for my technique using Juvederm to improve the tear trough and the corner of the mouth.